remove this cartilage covering, that's going to be super sensitive and it's going to cause pain. This is analogous to the tooth. You've got the enamel, the crown, lose the crown and it becomes super sensitive. Simple water, simple drink, anything will give you a lot of pain. Hypersensitivity, that's exactly the same reason, because the enamel is actually covering the actual nerve endings that are in the area. So that's the same concept here. Osteoarthritis refers, osteo meaning bone, arthro, as part of the word arthritis, refers to joint, arthrology, study of joints, itis refers to inflammation. So in osteoarthritis, the primary dysfunction or primary defect is wear and tear of the actual hyaline cartilage of the bone. Okay, so how does this manifest? Stages of osteoarthritis of the knee goes up to stage 4 or 5, depending on what scale you refer to, essentially meaning this is end stage and we now need to do a replacement, knee joint replacement. Otherwise, how do we manage, or how do we recognize this? Patient comes in, I've got knee pain, it's a constant ache, usually stiffness on either awakening or otherwise stiffness secondary to prolonged periods of remaining stationary. The key thing about the stiffness is it reduces with motion, and so that's always key. You can always recognize this because the joint is non-congruent on an x-ray. You've lost the joint margin, you've lost the congruence in the joint spacing smaller, you can see some osteophytic growths. But in a clinical setting you will see that the knee is actually multicondylate, it's multinodular, it's irregular, it's often swollen, it's often enlarged as compared to the regular knee. And remember, in an examination of the knee, always compare both sides, the good and the bad, or otherwise compare both knees to identify what may be normal from abnormal. So presentation essentially is just simply as suggested, pain with stiffness. Why do you get the stiffness? Very briefly, stiffness occurs because you've got irritation to the knee. The body responds to irritation by producing inflammation as per the actual immune system. That inflammation is quite viscous, as I might refer to it, and so what it does is it accumulates in the joint cavity, and in doing so it acts as a barrier to the actual bones moving. So that difficulty in movement is stiffness. As we move, that fluid that has amalgamated, that has accumulated, is now being dissipated away and with the motion, and therefore the stiffness reduces with motion. That's the reasoning behind that. Management wise, my advice usually to patients on the outset initially is to try some gentle heater on the area, on the back of the knee. If it's in the long term, if it's an acute flare up, then hot and cold anti-inflammatories are perfect for this kind of thing, as long as the patient is able to take them safely. Otherwise, simple analgesia, so paracetamol. Failing that, add some cocodamol in there, codeine phosphate, cocodamol, the likes of Zapane, and then you keep going up the ladder. But I will always use the adjunct treatments, so the hot and cold, mobilization of the knee, exercise of the knee. Why do we exercise the knee? Because we're trying to strengthen the muscles around the knee joint, just to remind ourselves the muscles actually cross the knee joint, and so stronger muscles will give greater stability to that joint. And that's where the rehab side of things comes in whatever form it may be, whether it's sports rehabilitation or physiotherapy or osteopathy, whatever. So exercise of the knee, mobilization of the knee promotes, it stimulates the production of synovial fluid. Synovial fluid is the fluid in the joint, and it lubricates the joint. The more lubricant we have, the less grinding that we may well have, and so therefore reduces symptoms also of that. One of the supplements that I often suggest patients to take is chondroitin, glucosamine sulfate and chondroitin. These usually help, but I always say just try it for 3 months, and if you see the symptoms, the difference in symptoms, then continue, otherwise dismiss the idea. I hope that helps. Any questions, any comments, don't hesitate. If you want any topics in particular, don't hesitate to ask, and don't forget to like and share the video. Thank you guys, take care.